Dr. Fichtenbaum says he started talking to his own kids about preventing STDs at the age of 12, when they were just 12 years old. And he says now you have to be careful to tell them what it means on some of these apps to swipe right. Christian Hauser now shares some of the other factors behind this trend.
Changing sexual behaviors is likely playing a role in the increase, including studies showing that condom use is decreasing among young people. So we talked with a few UC students about whether they use a condom every time.
I bring a condom, but I don't necessarily ask beforehand, if that makes sense.
Gotcha. So you always use a condom, you just don't necessarily ask if they have anything or anything like that?
Correct. I just feel like it's personal information, but it should be something I should probably do more.
Danielle Ashbrook also admits to not asking a partner if they have anything, but she says she also always uses protection and says UC makes it easy to get a condom.
They actually have them on campus. They'll actually hand them out throughout different events. They'll always have them out.
The CDC says most STDs don't show any symptoms at first, so someone could spread it and not know they have anything. That's why it's so important to talk to your doctor and get tested. But that's something some people are too scared or embarrassed to do.
That means they're going to have their infection for a longer period of time. The longer they have their infection, the more chances they have to transmit the infection to their partners.
One another reason for the increase is that more people are getting screened for a variety of reasons. So more people getting tested means more people would test positive. Now, all STDs are treatable, most are curable, and all are preventable. So parents, it starts at home with you, talking to your children about safe sex.
Having that conversation before a young person becomes sexually active is really key to protecting their health when they do choose to have sex, so that they have the tools available to them to choose things like using a condom consistently and correctly every time.
Christian Hauser reporting, Local 12 News.
I did put the full report on my Facebook page. The main concern was that it was being passed on to newborns, and that was a huge jump. And then the other thing was that if you look state to state, Ohio's kind of in the middle. We're not the worst. The worst was actually Washington, D.C., which I found very interesting. You can jump to all kinds of conclusions, but keep in mind you have a push there. A lot of things start because you have all these people in Congress saying, hey, we're going after HIV. We're testing now for HIV. We're making it available, and you test for every STD when you do that, and you're going to find those numbers. So I think a lot of that did kind of start in D.C.
Yeah, I went to a girls group, kind of a meeting, Girl Scout type group, and I was surprised because they literally just had a basket of condoms there. You know, they want to make it an easy conversation for young people to have.
So there's always that conversation. If we make these available, does it encourage young people to have sex? And my response to that is, if I give you a jump rope, do you want to exercise? Not necessarily.
Right.
You know, it simply gives you tools to do sometimes the right thing. And, you know, whatever that is for you, your mom and dad should be the place that you should be starting.
Good
That's
advice.
what we say. Yeah.